So you've probably seen another video of mine where I show you a posterior hip capsule stretch, but we're gonna optimize it. We're gonna give you the best angle here. So just get prepared. Take an elastic band, which I will have linked in the description below. Just set it up in a doorway, make sure it's firm, it's not gonna move. Get into a standard posterior hip capsule stretch position. So have something soft under your knee, like a soft foam pad, and really look for the areas of rotation that you feel the best stretch. So you'll see here, I started an external, and now I'm testing out neutral, and then I'm moving into a little bit more internal rotation, trying to see where do I feel like that deep capsular stretch is the most intense. I know for me, it's typically, it varies. Sometimes it's the external rotation, sometimes it's internal rotation. I usually don't feel too much at neutral. But then we're gonna make that even more intense. We're gonna make it even more effective. Get that elastic band, that rubber band, and you're going to have that pulling the femur back, so posteriorly. And now test those 3 angles of rotation. So at external rotation, you'll see now I'm a little more in neutral and pushing into internal rotation, just testing those 3. Again, figuring out which one do you feel the deepest, most intense stretch. So now we're gonna test a lateral mobilization. So you may feel more of a stretch when you get into a rotation in neutral, a different position when it's pulling laterally. With hip impingement, FAI, and labral tears, we just want to make sure that whatever angle the band is pulling isn't past this lateral, straight to the side. Because if we start doing it forward, it's pulling it forward. We don't really want that. We want to work posterior hip capsule mostly. And so what I'm doing here, I'm searching between pure posterior and pure lateral to see what angle of the band pulling is going to give me the most intensity of that stretch. And then I look at the rotation of my hip. And so you'll see here, I'm a little more externally rotated. I have the band maybe like 50 degrees angle from my hip because that's where I felt the greatest intensity of stretch. Yours is going to be different, or it might not be. You know, everyone's a little different, but instead of just giving you a standard one, I would rather teach you how to find the best angle for you. Ultimately, this will give you some short-term relief. What I find is people usually immediately after this get maybe 30 minutes, maybe an hour, where their hips are feeling a lot better. But the main complaint I get from these people is that it starts to go back to what it felt like before the mobilization. And that's where we have to remember the difference between short-term and long-term effects. In the short term, we can get a pretty intense mobilization. We can get some pretty good results here. But then they're gonna feel like they come back down to here. Then we do it again, and then they feel like they're gonna come back down to here. But what's actually happening, if this is where we started, short-term effect all the way up here. And then we start to come down. It doesn't come back to the level, it comes right here. And the next time you do it, same effect here, right? Over days, weeks, months of doing that, we slowly make it more flexible in the long term. Now, getting the flexibility and the mobility out of that joint in the hip capsule is one thing. Another thing is being able to use that mobility. And that is where therapeutic exercises come in. So it's not enough just to do these mobilizations, because if we don't demonstrate the proper muscle flexibility, all around joint mobility, strength, control, stability of that joint, we're going to start to get into our same compensations, and that posterior hip capsule is going to start to compensate again. And we're just going to repeat this process all over. So really the way to maintain these results is to get on a proper therapeutic exercise program that likely includes hip strengthening, stretching for specific muscles such as the hip flexors and the piriformis, some other joint mobilization techniques. That's really going to give you the long-term benefit of this posterior hip capsule stretch. If you're looking for like short-term, like, oh man, I need to get out of pain right now, this is really good for you. But if you want that to stick in the long term, you need those additional parts that go into human movement. That's actually why I created Pain to Perform, FAI and Labral Tears. I took my history as someone who suffered from these conditions myself, as someone who has treated patients as a doctor of physical therapy, and looking at the peer-reviewed research to come up with a 4-week plan that incorporates these joint mobility hip capsule stretches with hip control, motor control, muscle strength, muscle flexibility, and all around stability and core and hip control to make sure that your hips don't regress after you do these mobilizations, right? Remember, that's the key. So I designed it so that in only 4 weeks, you can get to a very, very manageable point and even eliminate your pain from FAI, hip impingement, labral tears, whatever you are suffering from. But first, I would advise you to actually check out my free course. It includes 5 free videos on soft tissue release techniques specifically for FAI and labral tears. So you can check out Pain to Perform, FAI, and Labral Tears, that 4-week program designed to get you where you want to be. But if you're not so sure if that's for you, I totally understand. That's why I made a free course that is soft tissue release techniques for FAI and labral tears. And that's all through my free app, You Improve PT. So you can check the link in the description below for all of that stuff. But that free course